You feel fine. Your labs look pretty good. And your ASCVD risk score says that you're low to borderline. But a scan can tell a very different story. You got calcium in your arteries. Should you worry? Let's talk about a simple test called CT Coronary Calcium Score that could completely change how we treat our heart. 1. ASCVD Risk Score. That's the traditional starting point. We usually start with the ASCVD risk calculator, Atherosclerotic Cardiovascular Disease risk calculator. That's to estimate your 10-year risk of heart attack or stroke. It uses your age, your cholesterol level, your blood pressure, your smoking status, and also diabetes status. But here's the thing, it's just a prediction. You can see what's really happening in your artery. Then, what is CT coronary calcium scoring? A CT coronary calcium scoring is a quick, non-invasive scan that checks the plaque in your heart arteries. The more calcium you have, the more plaque you have. The higher risk of heart disease you have. The score of 0, it means your coronary artery is clean, which is great. Score between 1 to 99, you have some plaque. Score 100 to 399 is moderate risk, you have more plaque. Score more than 400 is like a lot of plaque, your coronary artery is dirty. It's high risk, even though if your labs looks good. When your ASCVD calculator and your calcium score doesn't match, sometimes let's say your ASCVD score says low, but your CT coronary calcium risk says high because it's dirty. Or you could also be labeled high risk because of the age. When the age is high, when you input score of your labs and everything, your score could be higher. But that's when your CT coronary calcium score could help us fine-tune your care. So this is where the real value come in. When your cholesterol is borderline, the ASCVD score says maybe, then the CT coronary calcium score gives us clarity, along with the next generation markers like the ApoB or the LPA, which I cover in another video. You can check it out. This can help a shared decision making. Sometimes an ASCVD score says maybe, a CT coronary calcium score says yes. This will help us decide if you need statin or really radical lifestyle overhaul, or it could also help us avoid unnecessary treatment, unnecessary medication. Or it could also catch the silent risk before it becomes too late. So I have a patient who has the ASCVD risk score with just borderline 6%. But his coronary calcium score is really high. It's really dirty coronary. That was the moment he took his health seriously. And now he's thriving. So here's your prescription for the day. 1. Calculate your ASCVD risk. I'll drop the link below. Then you can also, if it's appropriate, you can also talk to your doctor to see whether your CT coronary calcium score makes sense. But don't do it if you're only a 20-year-old or even 30-year-old. You don't have enough time to have the plaque build up yet. If you're between 40 to 70, especially if you have borderline labs, this might be a good choice for you, a good test for you. So don't guess when it comes to your heart. Get the full picture. I'm Dr. Ming from One Health Medical Care. Stay healthy, stay informed.